Enter the room.
Good morning. My name is Dr. UKMLA-CPSA. I'm one of the doctors in this department. Could you please tell me your full name, just for confirmation's sake?
I'm Gwen McCarthy.
Okay. Thank you. Could you please confirm your date of birth?
I'm like 70 years old, if that helps.
Oh, thank you. I understand you'll be having some challenges after your post-operation, after you had operation. Is that correct?
Yes, doctor. I actually I fell and broke my bone of my leg. So yeah, I had an operation for that.
How are you feeling right now?
I mean, yeah, my leg is fine. I'm actually calling you for a different kind of a problem. I haven't passed stool since the time I was admitted.
Oh, sorry to hear about this, dear. But I need to ask you some questions. Have you been able to pass gas?
Yeah, I can pass gas. Yeah, I passed that.
Any swelling of the tummy?
Yeah, kind of. I do have some swelling.
Do you have any difficulties in wee?
No, not really. No wee difficulties. I can go to the bathroom to piss. It's fine.
And are you vomiting?
No, not really. No vomiting.
Okay, thank you. Do you have any allergy to food or any medication?
No, not really. Not that I know of.
Okay, I would like to quickly examine you in order to arrive at the source of the problem of this condition. Is that comfortable with you?
Sure, doctor.
Okay. I would like to check your back passage as well. I will need to look and feel your tummy. I would like to do a general physical examination, check your blood pressure, respiratory rate, and what is oxygen saturation. Thank you.
Sure, doctor.
Thank you, Gwen. Based on what you have been able to gather from what you told me, and based on the examination I've been able to done, I think you have a case called fecal impaction. Do you know what this means?
I understand what's fecal, but impaction, I'm not sure actually. What does that mean?
Okay. Do you have any special concern about this case? What is your most worries about your present condition?
I mean, quite frankly, it's been like 4 days since I, pooped, and that's what's concerning me the most.
Okay, so you think your most expectation is how we can relieve this situation, right?
Absolutely. I mean, that would be great.
I understand where you're coming from. We are going to help you concerning this. Actually, fecal impaction happens when, for certain reasons, the way digested food moves from the stomach to the intestine to the outside is impaired. As a result, waste material get accumulated in the passage. And from the way I see it, what precipitated this condition is most likely as a result of the medication you are giving, because it contains a substance called opioid, and after operation we normally give this medication. It can impair with the way people pass stool. So what we are going to do right now, one, we are going to ask you to increase intake of food.
Okay.
Then we are going to give you some stool softener.
Okay.
Like Senna. So it's going to help you. Then we'll keep monitoring your situation. If there is no significant improvement, then we are going to give you something that you are going to take orally that is going to help you, like this Codeine is going to help you. But right now, we are going we'll start with this management. We increase fluid intake, then the kind of food you are going to take, high fiber diet. Then if after 3 days you are still unable to pass physics, then we may have to take you to the laboratory into the we are going to perform a procedure that will manually remove the fecal impaction, which we call enema.
When are you going to do that? Like, are you doing it right now?
If after we've done all these steps that I said, if you are still
How
unable,
long will that take, doctor? It's been almost 4 days since I pooped. What else are you waiting for?
Yes, we are going to do, but before we do enema, we'll first try to give you some medication to soften the stool, then to increase the way, laxative to increase the way the cells of your intestine function. But if those ones fail, then we are going to put certain things into your back passage and try to remove this. But we don't often do it as first time. However, if you notice that your condition is deteriorating, like you're having increasing tummy pain and is causing you discomfort, then if you are not able to pass gas, you need to tell any member of staff. That means we have to do the enema straight. Do you understand me?
I've already been here for 4 days. When will I get discharged if you're going to keep doing these things? Like, can't you go on with it?
Once we stop the medication that is likely to be implicated, your
I'm
condition.
sorry, wait, hold on. You're going to stop my pain medication?
No, we are going to replace it with another medication that does not have effect on the way you
No. I don't want the replacement. This medication works fine. I like this medication. I don't have any pain. Why would you replace it?
I understand your concern. There are other medications that are equally effective, but without this side effects. Once we stop it, then we commence this management. Most likely, you feel better.
Okay, yeah, that sounds good.
I will give you a leaflet where you can read more about fecal impaction. Then I will direct you to the NHS website where you can read more about it. Are you comfortable?
Oh, yeah, sure.
Okay. So just to summarize,
but when will I go home? You want to do all this? You want to give me?
You are unable to pass physics, but you can pass food.
Sorry?
Yeah, gas. So we are going to commence you on treatment that's going to help you. Is that comfortable with you? Is that comfortable with you?
Doctor.
Yeah, thank you.
Hi, Dr. Kent. I would say this is way better. I would want to say that this time you did keep your data gathering short for sure, but you didn't ask some of the important questions. If you see in the question itself, you have been told that she's had hemiarthroplasty 4 days ago. She had a femur fracture. She hasn't passed 2. So you already have these information. That's true. But you need to confirm these information for sure. Right. So you asked me what my problem is. You said there is you have to ask a little bit about the incident history. Ask her when what happened for you to be admitted in the surgery. Right. So then she'll say, I fell, I broke my leg, so I came in for a surgery. It's like, oh, I'm so sorry to hear that. So how is the pain? So you have to ask about the current condition. So you did ask me that how is your current condition? How is the pain? So I said, yeah, it's fine. I don't have that problem, but I have another sort of a problem. All right. So you understood that. But you also have to understand that she is taking cocodamol, right? There could be other medications that could be causing her this. So ask her, like, do you have any idea what medications you're taking? So that she's able to tell you the list of medications that you might not, even though you have an information that this could be cocodamol, you need to confirm that she's not taking something else either. Right? Like, is it the cocodamol or is it something else? Because even though you have the information, even though you know what the case is, you have to know that there is nothing else causing the condition, right? And also another way of asking this would be, is it a chronic condition? Has this happened to you before? how was your bowel movement before you came to the surgery? That way you will understand that, this is something that is happening due to the medication that is started in the surgery itself, right? What if she's having IBS or, IBD? So she could be, probably it could be that, but you needed to confirm that. So it would have been a good question to ask, do you have any medical conditions? Right. This way you are ruling out in your head that there are no other cause for the constipation apart from the cocodamol, because you have an idea that this is cocodamol, right? But you need to understand that there is nothing else causing it.
Okay.
Do you understand? So even though you are told that something might be the cause, you shouldn't go by the person, what you have to confirm it from your knowledge by asking the right questions. So the questions in this case, the scenario is basically this patient has constipation for a long time. 4 days is a long time. And is it the medication that is causing it? Does she have a long-term condition? That's what you have to find out, right? Why is she having it? That is your task, and manage it, right? But good job, you did ask me a lot of good questions. I think we can just go into the workbench and we'll just check out how to do this case. I will also be showing you how you performed your performance, right? Just 1 second. All right, so this is your performance. So you did confirm the full name. That's a good job. You asked me about the bowel movement. Yeah, definitely. So if you had, so one thing to save time and to save, the need for asking a lot of questions, you can start with an open-ended question. It's like, hi, you ask the questions of my identifiers, what's your name, what's your age, and so I can see that you have been admitted. So use the information that is given to you to your advantage. So you know that I have been admitted with a fracture of my leg, and I had surgery. And so what is the problems that you're facing? So the one way to answer this would be, hi Gwen, I can see from my notes that you were admitted for a fracture of your leg for which you had surgery 4 days ago. Am I right? So she'll say yes. So that means you've confirmed it. She's confirmed the fact that she was admitted. You don't need to hear it from me. So all right, I can see that from my notes that you haven't passed stool. Is like yes. So then once you confirm that fact, then be like, can you tell me more about it? So that's an open-ended question, right? So you've confirmed what all you know. So rather than assuming, confirm it from the patient. So after confirming what you know, ask her an open-ended question like, can you tell me more about it? So then she will be saying, oh, there is a lot of pain, I have bloating, and I have so much problem. So when you ask a patient an open-ended question like, what is your concern, they have a lot to say. So that way you don't have to keep asking like, do you have bloating, do you have pain, have you passed stools, all that, have you passed gas? So from the open-ended question like, can you tell me more, after she says, if you still have more doubts like, have you passed gas, then those closed-ended questions you can ask, right? So yeah, so the duration, you didn't ask me for how long I've been having this, right? So that is something that I
No, the
also
patient said for 4 days.
I did say that, but I said it a little towards the end where I was like, doctor, you're going to do all these treatment. I haven't passed through for 4 days. But that is something that you should ask in the beginning itself to understand the intensity of the condition. So whenever you have a condition in your mind, you always have to ask the intensity. 4 days of not passing stool is a long time, right? So it could be due to a lot of problems. It could, some really bad problems can also happen, like toxic megacolon, which can be a very fatal condition. So 4 days is actually a long time. So if you have 1 or 2 days of not passing stools, then you can give the management, like you said, that we'll try with the laxative and stuff. But 4 days is actually a long time. Imagine where all that stool is collecting, and stool is like contaminant, right? If it goes anywhere in your bloodstream, it's going to be causing havoc, isn't it? So, so to understand the condition's severity, you need to understand how long she's been suffering from, right? So 4 days she hasn't suffered, passed any stool since the surgery, right? So you'll, by asking these questions, you can understand the intensity of the condition that she's suffering from. So those are the tasks. Like that way, you can give the management accordingly. According to the severity, you can give the right kind of management, right? So that's an important question. That's why ODPARA or Socrates are very important to understand what is the severity of the presenting complaint, right? And then medical history, confirm. I don't think you asked the medical history. You didn't ask me any of the medical history. Current medication, you didn't ask what all medication, but you told me that I was on cocodamol. But you could have, that is something that you could have asked me. I could have had some other hypertensive medication or some other medication that could have been causing this. But that is something that you should ask me. Like, do you have any long-term conditions? Do you take any medications, to understand what could be the real cause? Like, is this the cause that I think it is, or is there any other factors that could be, contributing to this problem, right? And lifestyle. So this is something that you should ask, like, usually how is your diet like? Do you eat food rich in fibers, to understand how her bowel conditions usually are, or how are your bowel movements otherwise before the surgery? Have you been having normal bowel movements? Those are the things you need to ask to understand that what is the contributing factors for this issue. And right, red flags. Red flags are some important things. Yeah, I think you covered the red flags pretty well. And explore the ice. You did it very well. Good job. See, that's why you got it there. Like, what do you want? What is it that you're expecting from, calling me here? Because she's in the ward. She's in the hospital, right? So, like, what do you want? So, like, I want to be relieved by this. So you always have to give treatment to that patient. So you understand that this is a very severe disease because it's been there for 4 days and she's very uncomfortable. She's post-surgery. So her main concern is recovery from the surgery. That's always primary. If you have like a plethora of diseases, like she's had surgery, she has pain, she has constipation, which is the main thing that she needs to recover from. That is the surgery, right? So in order to do that, what all are the contributing factors that you need to make sure that she is pain free? And after that only will you be giving importance to the bowel, right? Because you after asking the questions, you understood that it's medication induced. So you can simply change the medication to prevent this, but you have to relieve her from that, annoyance, that irritation of being bloated and being constipated. So go for the phosphate enema in this first case, right? Because this is something, because her main problem is recovering from surgery. You don't want to add on to problems, right? So you want to keep her comfortable in the hospital, and she doesn't want to be in the hospital for very long. She's like, I've already been here for 4 days. Why do I need to continue being here? Just why don't you just give me the treatment so that my constipation is relieved and I can, you can treat my surgery recovery properly, which is actually your task technically if you think about it, right? So like, yes, absolutely, I completely understand, and I know it'd be so distressing for you. So how about we give you something called a phosphate enema, and you explained it very well. Good job on explanation there. So we'll help you, and then we can put you on laxatives so that you can have normal bowel movement henceforth, right? We'll also be changing your medication. We will give you the medication. As soon as you said change the medication, she was like, no, 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 my pain is fine, why do you want to change my medication? So that's a good, how you dealt with that question was very good. Like, I understand this medication might be helping you, but we can give you a medication that will have lesser side effects, so you won't have to face this side effect. I was like, oh yeah, cool, yeah, that works. If it relieves me of my pain, I'm fine, and on top of that, I don't have the constipation, I'm even better, right? So that's a good way of tackling that question. Good job on that.
Thank you.
And
I'm trying to look at the marking scheme.
I'm sorry?
I'm trying to look at the marking scheme, the ones that I did not mention.
Okay. Yes, absolutely, yeah. So this column, we've actually marked it in such a way where it's the important points. Like, these points you should ask, and the other points are you can ask, if you have the time, right? So try to cover the important points, because that is what's going to serve you more marks. So the points which have been important, they have double the marks of the points that don't. Just giving you an idea of how we are marking. But yeah, basically we're trying to emphasize that these are the things that you should ideally ask for a consultation. And then after that, management. So another thing that you can do is to investigate further that has the constipation become very critical. You can always do an abdominal examination to see, is how are the bowels looking like, multiple air fluid levels, is there an obstruction or something like that. That's also an additional thing you can do, but you can always hold it off if you have time. Like we can do further investigation just to understand this constipation hasn't gotten bad, So how about we do an abdominal examination, right? That is a further plan you can make. And patient education, explain phosphate enema, that was very good. And laxative, address concern, reassure the pain management and discharge. Like, because ultimately you have to manage the pain, right? Even though you're going to change medication, you have to manage that pain and the discharge as well. And then summarize and recap. And your interpersonal skills were great. Yeah, so ensure that the patient agrees with the management, because you need to give the patient autonomy, right? You can't do something to them which they're not comfortable with. So I said, no, I want to do this first. And then you'll be like, if they don't agree with your treatment, one other thing you can do is, all right, I understand your concern. How about I talk to my senior and we can come up with a better plan for you. That is one way to tackle those kind of cases where they don't agree with you. So you said that I want to put you on laxative for a while, and if it doesn't work, no, I didn't agree. It's like, okay, that's very stressful. Even though you change it, so and we'll try out with something reasonable for you. How does that sound? Yeah, that's one way to do it, where you don't know what to do. The best way is that, like, okay, I understand this might be uncomfortable. How about my ear, right? Because in FY2, you have to see your doctor, so it's not you have to make all the decisions for patient care. Yeah. So always try to ask them, do you have any questions, doubts? Because in this station, the main problem was you were doing a lot of talking. You should never doing so much talking. You never gave me opportunity to talk. See, that's one thing is that you have a lot of knowledge. You don't have to give all the knowledge. You only that they are saying with the time you have to be trained. It's a little bit about them. So she will be saying that, yeah, so, I will change. Yeah, no, but what about my pain? So that is one of the concerns, right? So when you say that this has been causing medication, that you have any, ask me that, or you have a question, I'll say, no, I don't want to change my medication. I like, so can you change? And then you will be giving a follow-up answer saying that, this other medication that we can give you would be giving you the same relief from pain, but it will not be having so much side effects. Is that something that helps you? So you'll be like, yeah, fine, all right. So now then after that you ask her, okay, do you have any other further doubts? So then she'll be like, when will I be discharged? You're doing so much to me. When will I be discharged? Right. So then so that's when you know what all questions they have. So now if you look at the candidate information, let's look at the workbench.
Please like and subscribe to Turing Med School. Good luck with your preparation.